Good morning, everyone. Thank you, David. Please, a round of applause for our director, David Kennedy. And today we are welcoming our first panel, which is a response to the keynote, which is everything that you've just heard this morning. And that panel will feature Jeremy Travis, the Executive Director of Criminal Justice at Arnold Ventures, DeVone, Boggan, founder and CEO of Advanced Peace from Richmond, California, Jeffrey Butts, Ph.D., Director of Research and Evaluation Center here at John Jay College, Vaughn Crandall, Policy Co-Director of the California Partnership for Safe Communities in Oakland, California, Fatimah Mohammed, Executive Director of the National Network of Hospital-Based Violence Intervention Programs in D.C., and Eric Cumberbatch, the Executive Director of the New York City Mayor's Office to Prevent Gun Violence. Leading figures in violence prevention reflect on the journey thus far and the state of the art and how it can be advanced. Please welcome our panel.
Morning, everyone. How's everyone doing? So we're in for a treat today. Following David's really remarkable and I think historic in the sense of marking a moment in time, talk about the emerging science of violence prevention. We're joined by folks who are doing this work on the front line, exploring what some of these new ideas mean in practice. So we're very fortunate to have the panel that's assembled with me here today. And there's your right to my left. Actually, your right to your left. Vaughn Crandall is here. Vaughn is the Policy Co-Director of the California Partnership for Safe Communities in Oakland. And Oakland has already been mentioned as a very interesting place, but California is a really interesting state in terms of what's going on statewide there. Next to him is Eric Cumberbatch, from New York City, from the Mayor's Office to Prevent Gun Violence, doing, I think, some of the most important and sort of conceptual breakthrough type of work, about activating community capacity in response to violence. And next to him is Jeff Butts. Jeff is the director of the Research and Evaluation Center here at John Jay and is doing the empirical work and the evaluation work, looking at these new approaches. And next to him is DeVone Boggan. DeVone is also from California and the leader of another initiative called Advanced Peace. Again, cutting edge, new thinking, new practice, really a pioneer in many, many ways. Next to him is Fatimah Mohammed, who is from, I'll get your longest title in the world here, National Network of Hospital-Based Violence. Don't you have an acronym? Can't we? National Network of Hospital-Based Violence Intervention Programs, the NNHVIP in Washington, Fatimah. So fairly simple what we're going to do here. I'm going to ask each of them to spend a few minutes, a short sort of intro as to what they're doing. We are reserving 20 minutes at the end of our hour and a half for Q&A. There are microphones here, and at the appropriate time I'll ask you to come up and find your way to a microphone. What we've decided to do is to explicitly, instead of just sort of talking about what they do, which they will do, but really to try to develop a theme across this panel, consistent with David's address, which is exploring, I'm taking Fatimah's phrase that she gave me, the gray area, the gray zone. What's at the intersection of our traditional, somewhat siloed ways of thinking about violence prevention? The police do this. Communities do that. The hospitals do this. The schools do that. But each of these people, they're here on this panel because they are exploring those gray zones, the intersections, the overlap, the intersectionality of this work. That's the emerging science. And that's what's so interesting, I think, to those of us who have watched this over the past few decades, see the work that these folks are doing as pioneers, as the people on the frontier. So, you cool with that? We're going to do that? Okay. So we're going to start let's see. We'll start with Vaughn. So what is this gray zone? I'm not going to tell you who's next because I always like to keep people a little bit on edge. So am I going to be called? Look at DeVone. He immediately got nervous. You see that? I could be the next one. Otherwise, you just go down and it's sort of boring, and she falls asleep, and everyone forgets what Vaughn said. So Vaughn, you're up first. So what are you doing? What's the partnership like in California, and what does this new sort of intersection look like, this gray zone look like for you in 4 or 5 minutes? Okay.
Thank you, Jeremy.
Yeah.
Good morning. So I just want to thank John Jay College and the National Network for Safe Communities, and it's so nice to be here. I'm an alum of the National Network and just see a lot of friends and family in the room, so just really happy to be here with you all. So very briefly, I'm Vaughn Crandall with the California Partnership for Safe Communities, and we work with a small number of cities, primarily in California, to develop and implement public safety strategies oriented towards achieving a triple bottom line. And that is to reduce violence on a community level, shootings and homicides, to reduce recidivism and victimization among young people who are involved in our intervention programs, and to build trust between communities affected by violence and police. And really, we've come to believe that the public safety future that we want requires work on all 3 of those levels, because we're really after, maximal safety with minimal incarceration. So that's what we do, and I'll primarily refer to Oakland today, although we work in several other cities. And right now, what we're thinking about and working on specifically, I'll mention 3 things. One is sustaining the work in Oakland. So David referred to this earlier, but we started developing this version of a GVI strategy called Oakland Ceasefire in 2012. And since then, through the end of last year, there's been over a 55% reduction in fatal and non-fatal shootings in the city of Oakland. Thank you. And yet there's still a lot of shootings and homicides. And so it's sort of like David said, unfortunately the work never ends, but what does often happen is when you've been somewhat successful, the political will that created the conditions for you to move, a serious reform agenda is not as strong as it once was. Violence is not a top-tier issue in Oakland right now politically. If you look at any of the recent polls, if you look at the recent mayor's race, violent crime is not an issue of top concern for most residents of Oakland. And so it creates a challenge for those of us who still have work to do on this issue. So right now in Oakland, what we're working on is we're managing some key leadership transitions amongst our team of police, intervention, and community managers. We're working with our organizing partners on a renewed campaign around the importance of continuing to reduce gun violence in Oakland and investing public dollars in young people at the very highest risk of violence. And we're essentially re-engineering the management processes we use for that work to ensure fidelity over time. And I think one of the reasons that's important is sustainability has been a critique of, I think, violence reduction work in general, but specifically of ceasefire. And I have gotten frustrated with that at times because the way I feel about it is you're talking about a complex partnership-based strategy dealing with a fluid and durable problem that's in many ways a product of, endemic social problems. And so that's not going to sustain itself, right? You have to have a strategy to sustain it. So the other thing that we've been doing over the last 2 years is writing this way of working into agency and city policy in the mayor's office, the police department, and the human services department. And so that's sort of what we're doing on the local level. And then just briefly on the state level, we're working with a coalition of other organizations, including Advanced Peace, DeVone, and the Giffords Law Center, to create a policy environment in California that will support a critical mass of cities to move effective violence reduction work, including, at this point, it looks like probably tripling the state's annual investment in violence reduction work at the local level. And one of the things that's important for so many reasons, but it also speaks to David's theme, which is that if we decided that, we wanted to compete with DeVone over who has the best model, or we wanted to say, like, Oakland is better than LA, I don't think it's not as powerful as when we come together and say we share a set of values, we share a passion for reducing violence in a way that's better for young people affected by violence, and will use arrest less. We're getting there through different mechanisms and strategies. But when we bring our voices together and say there is a common set of principles that the state should understand and should be embedded in the funding formula, and that if that is reliably pursued with public dollars, we'll see a return on the investment. So those are the two things that we're thinking about right now.
So, Fatimah, you look at these issues through a different lens and have been another pioneer in really incubating and bringing to maturity the view from this other lens. So hearing what Vaughn is doing in California and thinking in particular about policy changes and what's sustainable, but most importantly, what does this intersection look like between, in your case, the health perspective and other perspectives? What are you seeing on the horizon?
Is this on? Great, terrific. Good morning, everyone, and I want to also thank the National Network for the invitation and the ability to be on this wonderful panel. The National Network of Hospital-Based Violence Intervention Programs has been around for 10 years as well, and we are a network that brings together a unique model, one that looks at violently injured patients in the hospital and recognizes that hospitals see, the very people that touch all of these other programs, and that what was happening years ago before this model kind of got developed is that doctors, trauma surgeons would see a violently injured patient, look at their physical wounds, treat them as best they could, send them out the door, discharge them, and they'd come right back. In fact, we know from the research that violent recidivism, right, they're in re-injury, they're coming back, ranging from 20 to 40%. They're coming back within 5 years. So we know...
In your world, back means back to an emergency room.
The emergency room, that's right, that's right. And retaliatory violence, they're also, leaving with their violent injuries, and then their people are going and attacking, injuring others who would then come into the ER. And so doctors actually the development of the model started in Oakland with Caught in the Crossfire, known as Youth Alive. It was actually a violently injured patient, young man of color who said, who himself had recovered from his injuries. He was actually bound to a wheelchair. Wanted so badly, he as he's recovering, to change his life, and asked the doctors if he could come back and talk to other violently injured patients at the bedside as they're recovering. The idea is we need an opportunity to intervene as soon as possible. What folks will frame as the golden moment, right? This opportunity as people are beginning to think about their lives and say, how can we wrap around them services and support? What excites me about this model is compelling the medical world to get involved in violence prevention. It is saying that we have a role to play in this larger framework and helping people recognize that violence is a public health issue. There's as David mentioned, there's the science, there's the epidemiology, but in particular, I think the frame of seeing a violently injured patient in the context of that network, looking at the network science, in the context of how all these other models see the ways in which they move once they leave, engaging doctors, nurses in that conversation, and hiring violence prevention professionals or interventionists who do this work at bedside and follow the patient out in the community is really powerful. So it is, when we say hospital-based, we just mean that is a point of entry. It's a point of connecting to violently injured patients, but the work extends out into the community. And so the opportunity to connect with these programs, and in particular, I think, not only look at the patient from the perspective of recovery, which of course is really important from their physical wounds, their mental health, the trauma that they've experienced, the access they've had to housing, employment that our work does, and many of these programs do. But it's also holding ourselves accountable, I think, from a medical perspective, to the overall health of these young people over time. It's actually looking at ensuring that healing is present, not just the absence of violence. And I think that those relationships, we care very deeply about the people who are involved and can't get out and want to get out. We care very deeply about the folks who stay in for years and years and years. So there's a way in which that care, that identification of the need, working in partnership with community to own these practices as part of their engagement in the violence prevention work is critically important. I think something that we all share. I want to speak a little bit to in this piece around policy, and there's a lot of really exciting things going on in California, and I also want to give a shout out to Giffords Law Center for their work. We are co-sponsoring a bill, in California that actually looks at Medicaid as a source for reimbursement through insurance to violence prevention professionals. Our network was instrumental in getting the Uniform Claims Code, right, the code that designates doctors, nurses, that insurance uses to reimburse. We've designated violence prevention professional in the code. And now we have in the state of Pennsylvania, through an administrative change, they do already reimburse for violence prevention. So there's a whole new world.
Can we pause and recognize how powerful
really
that
powerful.
is? What you've done, since ultimately we're talking about sort of seismic changes in the way professions think about their responsibilities,
yes.
And resources should follow. So both of you have given examples of how resources are shifting slowly, but that's a big one.
It's a huge
That code
one.
is like
it's a really
the
big
Rosetta
deal.
Stone, right?
That's right.
Yeah, right.
That's
so,
right. And so I'll stop here because we have many wonderful people on the panel, and I'm excited about the discussion. But I'll just say, as you said, it's a seismic change, and I talk a lot about we're reaching this critical tipping point, and David speaks to this so eloquently. It is so necessary for us to talk about the continuum of work and really focus on elevating the voice, amplifying the voice of those who are affected by these issues. It's not just the practitioners. It is those who are on the ground doing this work and who have experienced this violence that we put to the center. And that is something that we share as values for this practice.
So, Eric, you head up an office that has in its title Prevent Violence, which is noteworthy in and of itself, but it's part of the mayor's office. And we're talking about sort of policy change. You've been asked with an appropriation of funds to really help shift, speaking of the paradigm, shift the paradigm in this city in terms of thinking of how does New York City respond to violence, much in the way that Fatimah has described. So tell us a bit about your office and what you think of as working at the intersection.
Sure. Thank you for the opportunity. Thank you for the platform. Good morning, everyone. I want to start with the first question, what are we doing? Because I think on a broad level, we're on to something really special in that it's growing nationally. So the first thing I would say, we're reimagining what justice looks like in New York City. That's the first thing that we're doing. And we're turning what has traditionally and historically looked like punishment, over incarceration and prosecution to resolve community issues. We're turning that into how do we heal environments, how do we heal individuals that have been harmed, and how do we heal individuals that are allegedly causing harm. So that's at the forefront of what we're doing. The second piece is empowering communities. All of the communities that we work in and all of the people that comprise our community, they're not in a predicament by choice. And all of these things that they're facing, stresses, levels of distress and disorder in their environment, in their community, has been intentionally done to our neighborhoods. And a lot of what we're doing is recognizing that empowering community to know that, empowering city agencies, justice actors that are in that space to own that, and then invest in communities to undo and start to unpack and untie all of those things that put people and keep people in a cycle that may or may not lead to violent acts in community. The third piece that we're doing is institutionalizing the civilianizing public safety, where we don't have to rely on law enforcement alone or the judiciary system alone to create public safety in our communities. So when we empower individuals to create the change that they want to see in their community, resource them and equip them to sustain that change, then we have healthy environments and healthy communities. And when we have healthy environments and healthy communities, we don't see violent acts. So those are the three core things that we're doing. In New York City, the Office to Prevent Gun Violence, we have a very robust, large office of a network of about 60 community-based organizations that we fund. We fund these organizations to do a number of different things that target young people that have some very real risk factors in their lives. And for us, we aim to be at every touch point possible where there's young people that can take up our services. So we have programming in Department of Correction. We have programming in both of New York City's secure detention facilities and about 42 schools. We're in 22 communities that account for upwards of 50% of New York City's gun violence. We have very nuanced ways of empowering individuals through grants and other opportunities to be part of co-producing public safety through their narrative and through their lens. We have public health-oriented and anti-gun violence messaging campaigns led by behavioral scientists so that individuals are empowered and are creating their own narrative in a space often where we've never been able to tell our story and we've never been able to show who we really are and what we want for our community. It's been pushed on us. So we're doing a lot of powerful work around lifting community to be the change that they want to see. So that's how I would frame what we're doing in the Office to Prevent Gun Violence.
Thanks, Eric. Yeah. So, DeVone, back to the West Coast. And
West Coast.
Yay.
That means I'm sleepy.
Yeah. Thank you for being with us this morning. Right?
Absolutely.
So you're listening to your colleagues, and you all sort of real sort of colleagues, and you're learning from each other, which is so interesting to watch. But tell us what you're doing, what Advanced Peace is up to, and then just a little comment on what it's like to be on the frontier here, if that's the way you describe where you are, which I think is true. Yeah.
Right on. Good morning, everyone.
Yeah.
So Advanced Peace is sort of a replication exercise based on some work that we did inside city government in the city of Richmond, California. I think one of the first things I'd like to say is one of the upsides of working on a replication exercise is that you get an opportunity to engage several folks from several different places around the country. So, for example, 43 cities reached out to us requesting consideration for replication of this 18-month Peacemaker Fellowship that we created inside city government. I'll say a little bit about that momentarily. But what that means, or what that translates to me in the context of what I've heard here and what I heard David reflect on earlier today, is I think more city governments in particular are interested in taking more deep-end engagements and making more deep-end investments into strategies that are effective at engaging those who are at the center of gun violence, those who are typically considered the perpetrators of such gun violence. So I think that's an important crossroad that we're at, that we're seeing more and more cities willing to lean in and really say, look, how is it that we can engage this particular population more dramatically and more dynamically, and how is it that we can further invest in that. Now, I say that because every city that we're working with, or at least engaging, is considering making a commitment of putting half of the cost associated with this particular fellowship on the table. And I think that's a pretty unique piece, and I think it's exciting to see cities willing to make not only a financial commitment, but a longer-term institutional commitment. We're also asking cities for like a 5-year minimum commitment to the strategy. I think that's a beautiful thing when you have cities willing to lean in and say, how we make these 5-year commitments, and how do we also align a 5-year funding commitment with a particular approach to engaging those at the center of gun violence. You know, I started inside government in Richmond as neighborhood safety director, and a couple of things that I saw happening sort of began, for me, a road down to this fellowship. So advanced peace is this replication exercise, but it's also sort of this concept, ideas about how we engage this particular population. So first and foremost, I think what we're trying to do is infuse love into public policy. How do we infuse love into public policy onto an individual or a group of individuals that rarely see it from public institutions? So as neighborhood safety director, one of the things that I continued to see as we were trying to engage this very vulnerable population, and again, I'm talking about individuals who typically avoid the reach of law enforcement, but who are also thought to be involved in recurrent gun violent activity. And the first thing I saw is that most of these individuals, if not all of them, were not being engaged by any public system or community-based system of care. So we got to do something about that. That's profoundly crazy that is a reality for most of these individuals, that they're not being engaged by any public or community system of care. So that was one thing. The other thing was, in many cities where gun violence is prevalent, you know, the clearance rates tend to be low, which means that a lot of the guys who are thought to be involved in gun violence are walking the very streets where they committed their gun crime. So for example, and because of that, I thought, and I think a lot of us believe, that those very individuals have to be tapped as a part of the solution for solving this conflict. Those folks have to be tapped with an understanding that unless and until law enforcement is able to remove these young people from the streets, they need to be encouraged, inspired, and motivated during that period to change their behaviors on their own. And so again, it requires a deep-in investment, a deep-in engagement with those very individuals. And then I think finally, I also think it's important that we reconsider how we go about engaging these individuals around employment. I remember as neighborhood safety director, I was told that, you know, nothing stops a bullet like a job. I think that sounds phenomenal. What I learned was it wasn't always necessarily true or the case. Why? Because like supportive services, these individuals aren't ready for those services, and those services aren't typically ready for these individuals. Jobs, the same thing. These individuals aren't typically ready for jobs, and the jobs aren't ready for them. So yes, it's important for us to neutralize gun violence and to do things that neutralize gun violence. It's also important for us to do a better job of mainstreaming the population that we're engaging with deep-in emotional attachments that so many of them are detached from, and that's what we're trying to do, create those attachments.
Thanks, DeVone. Great work. So Jeff, we saved you to last. You're the academic on the panel. You head up the Research and Evaluation Center here at John Jay. You're known to this audience for your work mostly on sort of youth justice issues, and you're trying to track and trace the trends in our approach to young people, and in particular in the juvenile justice system. But you've also developed a portfolio of work now looking at gun violence and evaluating a number of different interventions. So from that perspective, what can you say about what we're talking about here? What are you seeing? And it's not strictly a question of effectiveness, but what are the trends that you're noticing in interventions, in policy, in language, in approach, in conceptualization? What's the 30,000-foot picture?
Yes, I'd also like to thank everyone for being here today and inviting us to do this. We had a conference call to plan for this discussion. I remember Jeremy started off by saying that this was a group of people who were on the front lines. And I said, whoa, am I on the wrong call? I don't work on the front lines. I visit the front lines. And I'm the annoying guy standing behind the front line saying, yeah, that's not evidence. And I live in that tension all the time because I think when you ask about what are the trends, what are the commonalities, I can feel the field coming together. Listening to David a few minutes ago, the amazing thing to me was I totally embrace and agree with 90% of what he said. And most of my work over the last 6 years has been affiliated with Eric's office, with the Mayor's Office of Criminal Justice, and what people would call the cure violence model. And that is one of those other brands that 5 years ago were seen as in competition and contention with these other models. And it does feel like they're coming together into a field of practice, into a community of practice, which is very positive. My tension, though, is in order to sustain this, to bring this field together, I know it's tempting to use quick and easy numbers. And I said to Jeremy downstairs, I don't like this term cut. Because David said that this place cut this and this place cut this. Because cut implies if something goes down, we did it, and it's significant. And a researcher would never just say, violence was reduced by this much, and then celebrate. We would say, yes, but compared to who? Compared to where? You always have to have a comparison group. And media, I assume some might be here today, but media are really bad at this. And they've done it even on my own studies. We work really hard to do what's called a matched comparison site. So we're evaluating the implementation of the crisis management system here in New York, which draws upon the cure violence model. And we see declines in our neighborhoods. We track not only criminal reported shootings or police reported shootings, but also people who appear in an emergency room and with a gunshot injury. The state has great data on that that's geocoded. We can track which neighborhoods are showing the steepest declines in the number of people hurt by guns. And we put out a study, and we work really hard to come up with a good comparison site. So we compare this neighborhood to that neighborhood, which is matched up on demographics and crime trends. And then I talk to a reporter, and the story comes out, and it says the program reduced violence by 42%. And I know, wait, it's not 42%. The neighborhood went down by 42%, but the match comparison site went down by 20%. So you have to state things in more complicated metrics, which people get tired of, and it gets complicated, and no one wants to hear from the Ph.D. in the room and I totally agree with that. I'm always telling my own staff, like if you have a Ph.D. and you're an academic, you probably are a bad writer. Because academics are taught to write poorly and taught to be confusing. And in order to puncture that, you have to have the training and skills of the researcher in the room, but don't let the researcher represent the findings. And that's a difficult thing to pull off. But I think the National Network, other programs around the city, Eric's office, the examples you've heard from previous speakers, are starting to get this harmonious blend of improving practice, achieving results, and communicating and disseminating the results in a way that the public can understand, that policymakers can understand, which I think is essential. I said 90%, I agree with David. The one thing I want to quibble with is he kind of threw the whole field of social work and human services under the bus, which is where I come from. And I agree with him if he's talking about social work as it appeared in the 90s, where everyone was interested in third-party payments and it's all about individual therapy and counseling. That's not what social work was meant to be. And when I got in the field, and when you read the history of social work, the models that we're talking about today and the model that David described is social work, and that's how it started out in the 1900s, 1910s, and 20s. That field has lost its way a bit, as a lot of us have, but I think if you pay attention to where human services practice is today, they would totally resonate to this approach. So I think And maybe we're being a little too Pollyannish by thinking that this is all coming together. And I suppose once you get to a certain age, you get tired of fighting and bickering, and you want to bring things together. And I always say, you get further along by promoting a positive view of something than criticizing what's gone on before. So it feels like things are coming together to me.
So, thanks, Jeff. Yeah. So let's pick up on one of, there are many themes across this panel, but I'd like to pick up on this one as our first one, and hopefully we'll do another, and just start with Eric. One of the ideas that was in David's talk, each of you has mentioned, was a different form of support and engagement for the population at risk. And DeVone mentioned it as the people that nobody engages with or they're difficult to engage with. But that seems to be central, you talked about it as well, to this, at least this panel's discussions about your work. So just take us a step behind that thinking, and what are the challenges there, and how does it change the way that either community organizations or nonprofit organizations or government should do their work or do their work differently vis-a-vis that population? That seems to be a central theme here.
So I would look at who's doing the engagement.
All right.
The strength in the neighborhood is the people that are in the neighborhood. And if we're not recognizing and amplifying their skill set and their abilities, then we're missing out on the greatest resource to engage any so-called hard-to-reach or so-called at-risk individual in a neighborhood. So the people that have direct access and can serve as guides, mentors, shepherds, organizers, they already exist and they're already there. And in all of the communities that we're talking about, these are some of the most resilient communities in the country. They've been healing and living through trauma on their own for generations. So we have very granular networks that are already established. We have pathways to recognize individuals and get them the type of assistance and resources that are necessary. But it's rare, it's just new that government is recognizing that power is in the people and actually having the courage to say our role in government doesn't necessarily have to be paternalistic and pilot into a community. But instead, we could recognize the power that's in community, equip them with the skill set, take a step back, continue to supply them with data, and let community actually thrive and let community actually live. It sounds like it's counterintuitive. It sounds like it's non-traditional work, but it's the most traditional way of existing on Earth. So I really think it's how we reimagine how government and city institutions actually touch people and understand the wealth of value, the wealth of knowledge and expertise that lies in the neighborhoods that we're discussing.
Right. I have a feeling DeVone wants to jump in here.
Yeah, I definitely got to jump in on that. And I just want to just say thank you for that, Eric. You and I were having a conversation before we came on stage. You know, when I was, again, neighborhood safety director inside a government, one of the first things we decided to do, it speaks to who's doing the work, but it also speaks to who the user of the work is. First thing I did was I hired 3 individuals who were actively involved in gun violence to serve as office aides in this city government office.
Hey.
Why would I do a thing like that? Well, because I wanted real-time, real-life, raw talent and information coming at me, right? Somebody that could tell me when my stuff stank, somebody that could tell me that's going to work, that sounds ridiculous, you should try that, you shouldn't try that. So that's the first thing. I think it's also about involving those who are at the center of the issue that we're trying to address, empowering those young people or young adults to become a part of the solution equation. They have to be there, right? They have to be a part of our conversations. They have to be a part of our discussions. And that requires of us to see them different. Our ideas about who they are will be the substance of our behavior towards them. And so if we see them as a problem, we're going to treat them as a problem. If we see them as a part of the solution, then authentically and genuinely, we're going to treat them as a part of the solution. That's critical.
Right.
The second thing that we did inside of this particular city government, I'd like to say is the first government in the country to do so, is we decided to hire street outreach workers, employ them as city employees, right? And we decided that one of the minimum qualifications that we were looking for was that, one, preferred they be formerly incarcerated individuals, formerly incarcerated assets coming inside of government to help us solve a problem that we've demonstrated that we couldn't do without them. The second thing that we decided to do as terms of preferred qualification was that each of them had to have a firearm-related charge in their background. Can you imagine what happened inside city government when I proposed this new classification of city employee? Are you crazy? We're going to create a revolving door of criminality. My initial visceral response to that statement that truly happened was, this would be the first time? Right? Are we serious? Right? But again, in Eric's reflection, we have to appreciate this individual group as an asset that deserves to be recycled, again, to help us do something that, as governments, we've demonstrated that we cannot do. The second thing after getting that, and let me just say this, because this is important. Folks thought it would be a revolving door. I hired 4 full-time neighborhood change agents in February of 2008. I left city government in March 2016, and 3 of those 4 still remained inside city government. One of those 4 took my job as neighborhood safety director. That was deliberate and intentional, and so we have to be much more deliberate and intentional about this work, which requires that not only do we embrace the group of individuals, but that we are deliberate and intentional about our investments into their personal and professional development. I was spending $5,000, $6,000 a year for at least the first 4 years on every single street outreach worker, just in training and development on them. So it requires an investment in these individuals. 2, I think it requires that we pay them a livable wage. Right? We want, let's definitely send a shout for that, right? Because I'm not looking for a street outreach worker that'll be around for 6 months. I'm looking for one that'll be around for 5 years. Why? Because that translates into trust in those communities that we're engaging. So I want to make the responsibility, the role, and the function, and the pay attractive to developing someone over a long period of time. Again, the ideal being the substance of our behavior. We want you here over a long-term commitment with us to, again, engage a population that, quite frankly, isn't being engaged by anybody.
Thank you, DeVone. Great. That's what that sort of pounding of the feet on the floor was all about. Just had to get it out. It's great. Love it. Fatimah, so you had a version of this observation as being central to your work, which is continuing engagement with patients, right, who are thought of as having the hospital responsibility outside of the community. So what does that look like?
Yes, so I want to just echo all that's been said about the investment in those who've been impacted by the challenge, right? And know and see. Now we have burdens or barriers in the hospital to employing formerly incarcerated folks who have violent charges, but our doctors are advocates for that. So it takes time to have institutions adjust to these values. I want to, say that the investment in training for frontline workers, for those who are doing this work, is critical and itself a program outcome. itself a program. I think some people miss that part. And again, I want to say something else, DeVone, when you were sharing earlier about 50 cities contacting you about this, part of me was both excited and also nervous. And this is another challenge with this work, is that people hear about this and they go, oh my God, yeah, I can do that. And then they go off and they read about it online and they say, oh yeah, we can do an advanced piece. They look at hospital-based violence intervention work and they're like, oh yeah, we can do that. You can't, the level of values the way you have to see the issue, it takes a certain kind of person. It takes a certain kind of leadership. It takes a certain level of engagement to make these models work well, consistently over time. And I think that one of the problems we're going to face as we tell the world, right, about the success of our model, is how can we articulate those values across all these programs and call it out when it's not happening the way it's supposed to. Because if we are not successful in doing that, what we're going to replicate is a name and a brand out there in the world with all sorts of misalignment of values. And people will say, well, we tried advanced peace. We tried, the New York model, the health department tried, and it didn't work. And so we're thinking about that, with our model at hospital-based violence intervention work, we decided to go the route of slow organic growth. This model started in the early 90s. We have 35 members, but there are another 15 to 20 hospitals that are beginning to engage in this work, and communities. They can be community-centered, linking with the hospital. And we have, to become a member, we say, you got to show us something, right? It's not just that everyone can come join. We care very much about program fidelity. We have to. And there's another piece in what DeVone said, which I think is critical and connects to research, which is about allowing those who we serve, those who are seeing the issue and seeing it change in real time, that we are held accountable by them at all times. And what's challenging, I think, and what I get excited about community participatory research is the opportunity to have them engage with data and engage with their own sense of what's happening and connecting it to what researchers are seeing. And it speaks to your point, Jeff, about, I want researchers to know how to do that, because when we disconnect those worlds, we're not actually allowing communities to begin to own the work over time. I think that when researchers, of course I care about good research, right? I think that we need good methods. We need to think innovatively about methods. But engagement in community is a critical part of research. It needs to be a critical part of research to maintain the values we have in these models, and to ensure that people feel connected to this work over time. I want this to be a movement, and it requires people who may not be practitioners on the ground doing this work to understand it enough to tell its story, understand it enough to continue to promulgate the message. This is how large public health movements have happened in this country. The anti-smoking movement, right? How we've been able to address things like AIDS. It took people who were affected by those issues. It took people who were in state houses across the country and in Congress talking about the over and over again. And we, I think, need to do a better job of articulating what this work is for everyday people so they understand it. And it's going to take significant narrative work. And I'm sure many of you have sat in places like this where they talk about narrative change. I hear it a lot more now. What is narrative change? What does it mean? It is seeing differently a challenge that we assumed was one thing, but is actually another. It is recognizing who's engaged in the work of violence prevention. We need police, we need law enforcement talking about this work because we assign law enforcement exclusively the role of addressing violence, and it is so much more complicated than that. And so I think there's just a lot of components to this that we need to address.
So let's use that last observation as a chance to return to something that Vaughn said that may have slipped attention. And there's a story, I'm sure, behind the California decision or imminent decision to significantly increase its investment in this type of work. And we talked about it a bit downstairs. I'm not sure how directly you've been involved, but you're close enough to help this group understand at a sort of political level. How did that happen? What if we're talking about a movement, we're talking about a new way of preventing violence, a new way of working with communities, and a new way of ultimately investing public resources. This seems to me like an important example for us to lift up as being worthy of a little bit more narrative from you. What's happening? Right.
I think that's a great question. So I would say that I think that story, there's the complicated version, but I think the simple version starts with the fundamental kind of realization that DeVone talked about earlier. Really, that's been the theme so far already, which is who is actually affected by gun violence, right? And let's really be rigorously honest about that and understand it. If I just tell a little bit about the Oakland version of that story, it will weave directly into what's happened at the state policy level. So the version of that in Oakland is forever the public and community narrative about what was driving violence in Oakland was that violence was driven by people who were under 18, juveniles, and it was about competition over drug turf, and it was economically motivated. And they had been making policy to deal with violence forever based on that idea. Youth curfews, aggressive street-level drug enforcement, outreach that was oriented around young people. When we came in and working with local folks, studied homicides in depth over a period of years, what it reveals is that narrative was almost completely wrong. And that in fact, as we now know, homicide in Oakland is primarily driven by conflicts between young men who are on average in their mid to late 20s, in networks, and they are using violence as a way to resolve disputes between groups and between individuals involved in these networks. And that in any given year, it is about 200 to 300 guys in the entire city of Oakland that rise to this very highest level of risk category. So if we take that and then go to the state level, the state has one funding stream called CalVIP that in the state of California, a place that has 1,400 gun homicides a year and over 4,000 non-fatal shootings. That one funding stream in a state with 40 million people is $9 million a year. And traditionally, it went to whoever for whatever. You could apply for a CalVIP grant to do DARE or GREAT or police community calisthenics in a park. And so part of what's happened is, as the success of DeVone's work in Richmond and the success of our work in Oakland and the success of the work in Los Angeles and development of gang intervention and partnership-based work there has demonstrated these reductions in violence year over year, there's this common theme here where people are saying, we need to focus on people who are at the highest risk of violence now. We need to invest in community-based intervention, as Eric was talking about it, and we need certain kind of police reforms that will create the space for community-based efforts and then, when necessary, will intervene in a way that disrupts actively violent conflicts. And so I think it is the aggregation of that kind of success in a couple of different kinds of cities, and then the work of folks like Giffords who have magnified that, Fatimah, to your point, with the right kind of narrative that speaks to policymakers and in a way that is used effectively in the political arena at the state level, which is not, I don't know how to do that, but they do. And so I think what it's been is it's taking these success stories and saying, here are the basic themes and principles and practices that have driven effective work. Focus on very highest risk folks, put the money into communities that need it the most, make sure that people are following a strategy that they can make some claim as having an evidence base, and holding people accountable for outcomes. Reducing shootings and homicides every year as the way you measure success. And so I think it's just been Enough cities that matter for policy in California have done that, and they've made the intentional decision to work together in the policy space in a way that is tipping the state.
DeVone is another Californian. You want to just comment, give it any other insights into the California story?
I can't. You know, I was thinking, God, I'm glad Jeremy asked Vaughn that question because I think he nailed it. And I think the folks at Giffords would really appreciate how, and the folks in California in the space would appreciate how he articulated that answer. Yeah, I think it's spot on.
Certainly sustainability, comes with money, among other things. When you think about most of my work has been on reducing mass incarceration. You think about where we spend money in the criminal justice system, it's not here. It's not this work. So I was at a conference yesterday talking about how to reduce the expenditures on prisons in America over the next 10 to 20 years so that money can go to the communities that have been adversely affected by crime, and we can build better community capacity. So just my editorial comment here. We spend money elsewhere on things that should be spent here. So, yeah.
Yeah, Jerry, thank you. This triggers one thing that I meant to mention. So the other reason that I think this opportunity in California is so important is that relative to some other states like New York and Massachusetts, California spends very little as a state on reducing violence. California has, however, led the effort to reduce mass incarceration. Now, some of that's been forced by the courts, but the fact is there are 40,000 fewer people in California prisons than there were in 2011 after realignment. And what that means is that today, 90% of people in state prison in California are there for a serious violent or sexual offense. And so what that means is, I think we've gotten about as far as we can get undoing mass incarceration, only working on non-serious, non-violent drug charges. And so part of why I think unifying the field around violence reduction is so critical is we have to take violence head on now. Right? And we have to do it in a way that has a net reduction in arrests and prison sentences. And I think part of the argument that we're making and part of what we're trying to do is join our movement with the undoing mass incarceration or the sort of traditional justice reform movement to say we have to link our efforts because the continued success to undo mass incarceration requires that we take on violence in a different way.
There's one more editorial comment from your moderator who's supposed to be neutral, but I'm not. So it's so interesting. In New York today, maybe it'll get passed in this legislative session, there's a discussion about marijuana legalization. And a big part of that discussion is where does the money go? And a big part of that discussion is why shouldn't the money go to impacted communities that have suffered from marijuana enforcement? The justice reinvestment discussion, which is what do you do with reduced prison costs, has mostly gone to funding other parts of the criminal justice system, not to investing or reinvesting in communities that have been mostly affected by incarceration. California is leading the way, not just in reducing its prison population, much through court order, but through referendum and thinking about how to take some of that money and spending it. That opportunity, and some of us were just at a conference in Sacramento last week or the week before, talking about this issue. How do you take that money, put it at a table where the community gets a say in what that reduction investment looks like, rather than having to go into the general coffers? So next 10, 20 years, fewer people in prison by a lot, money goes elsewhere. That's my goal. DeVone.
I just want to lift up one piece or element that I think is important and be remiss to not in terms of why we've gotten to where we've gotten to in California around these policy goals, these funding goals. And I would just like to add how important community organizing from the grassroots has been, and coalitions of a variety of community organizing backgrounds. So, for example, in California, we have Live Free and the PICO network working at the grassroots levels with pastors and community members most impacted by retaliatory and cyclical gun violence that happen in black and brown communities. But we also have a working relationship with Moms Demand Action that comes from a different space of gun violence experience and engagement. And without those community-based organizations being organized, galvanized, and then mobilized, I don't think we'd be where we are completely.
So, yeah, another good. Another perspective in all this work is to look at it from the outside in. So the sort of lightning round question here for everybody is, what would you like government to do differently? That's a long list, right? So pick your favorite policy change or agency. We could talk about hospitals, we could talk about the police, we could talk about, we'll leave social workers just out of deference to Jeff to one side. But what would you like government to do differently other than funding? Because funding is a big one. Yeah, and you got your first up. What should government do to support this work? Policy change, engagement change, thinking about differently about how people are trained or interact with the sectors that you represent. Jeff?
Yes, I've visited a lot of the programs around New York, and New York's an interesting opportunity, like a lot of things about New York. We have so many of these community-based programs that are operating right now. It provides a natural experiment on how they operate and what their philosophies are. And Eric and I have talked about this here. I think government needs to exert some quality control over programs. The problem is the tools that are used to do that are so old-fashioned and clunky, and that means contracts. And the one thing I've said this before to the Mayor's Office of Criminal Justice, that I wish there was some mechanism that would allow a city to identify the natural community-based organizations and all those assets at the neighborhood level, set up funding to provide them with the resources they need to do this work, but not ask all of them to become MBA quality nonprofit managers. And when they have to do their own accounting and find their own storefronts and hire their people and do their HR and their payroll, you lose a lot of potentially very valuable assets in people. And the drift is, and the risk is, the organizations that are effective in that environment tend to be the bureaucratized, professionalized, here I'd say midtown organizations that have the ability to hold on to those contracts and have the relationships with city council to keep the money flowing. And what you really want are people in the neighborhood who may offend people in the city council, but can do the work and have the mayor's office or the city provide the infrastructure that they need so they don't have to deal with all the crap that comes along with running a nonprofit. And I wish, and I don't know if you guys are thinking about that, but I wish that's what cities could do, especially in a big place like New York or LA.
I'd like you to answer the question, what should government do differently, and recognize you work for government, but also just if you could take a moment to talk about your office's, you call them micro grants, or your small grant program, which I think is really innovative, but also the big question.
Sure, so I'll start with the micro grants piece. In doing this work, and you're in communities and you're working with people who have experienced traumatic events, you always are engaged or meeting with the unofficial, quote unquote, mayors of a community. And what we wanted to do was activate that network. How do we build a network of people that aren't part of a community-based organization, may not be part of clergy, but have great hearts, great minds, great ideas, and want to feel that government is investing in them so that they can create whatever change it is in their community that co-produces public safety. So we issue a small grants program in New York City called the Safe in the City Grant, $500 to $1,000 to incubate great ideas, cultivate great leaders. For us, it's more than just the programs and projects that the individuals are doing on the ground, but it's a force multiplier for our office. So we've built a network across the city of over 200 people who have received these awards that at any given moment, we can activate that network and call into service. So it's a great piece in showing, one, that government has confidence in the community, two, that everyone can play a part in reducing gun violence, and three, it's up to community to change the culture. So as we're doing this very intensive engagement on those that have the highest risk factors, there's a whole host of individuals, the other 99.9% of the community that's there, that we can work on cultural change. We could work on community empowerment. We could show what community investment looks like. And we're doing those pieces through the Safe in the City grant. The larger question that you have, what can government do different? And I never saw myself in government. That wasn't the trajectory that I was on. And in coming into the mayor's office of criminal justice was my opportunity to blow up what criminal justice has always looked like in New York City. And I say that to my director, Liz Glazer, to this day. She doesn't cringe anymore. She used to cringe when I would say it. Now she just nods her head like, I'm with you, because she understands where I'm coming from. What government can do more is reflect the population that we're talking about in terms of service delivery. So we have a lot of leadership that is absent, doesn't look like the communities that we're talking about, doesn't understand and or care to be informed by the community members that are most impacted. So for me, representation is key. And there's a lot of great minds that are in this space, but those great minds need to learn how to lead by being an ally and not lead by being an overseer, and actually put the power into the hands of the people that are closest to the adverse action. So that's what government needs to do.
Vaughn, back to you. What should government do differently?
So 3 things. One I would say is I think governments need to invest, local governments need to invest in the kind of offices that Eric and DeVone lead. And I think that is an essential thing that more American cities should do and more are starting to do now. And in California, a lot of them are funding that with local parcel taxes, so they have long-term funding. The second thing I would say is we haven't talked a lot about police in this conversation, but I would say from my perspective, call it police reform or call it 21st century policing, changing the way that policing works is an important part of this conversation. And I think that what works most in terms of the way police operate to reduce violence is very non-traditional. And I think more police departments should vest that responsibility in a senior, uniformed person who owns it, a deputy chief or assistant chief, as a chief of gun violence reduction, and think about the kind of outcome measures that we've talked about in 21st century policing. Like, your job is not just to reduce shooting and homicides, but we want the net footprint of the department to shrink over time: arrests, complaint, uses of force. So I think that would be the second thing, vesting that in police organizations as somebody with power, their job. The third thing I would say, I'm not sure if this is government function, but it's needed, is I think there needs to be a place where policymakers at the local level who make the decisions about where resources go and the models they will use, mayors, chiefs of staff, perhaps council people, have a place to go and be trained in what is effective in reducing violence, because they are so influential over what happens, and they're generalists by necessity. They just don't know, in a sense, how do they leverage the resources and people they have and what actually works. So that would be a third thing.
Fatimah, what's on your wish list for government to do differently?
Oh my.
The top tier.
Top tier. Okay, I'll focus. I have 3 things as well. We've talked a lot about local. I'm going to talk a little bit about federal and state. I work a lot with Victims of Crime Act funds. It's an $11 billion fund, a cap about $4 billion. Remarkably uncreative use of those resources. States largely don't spend the money that they're given by the federal government, this $4 billion that are distributed to states that can go towards some of this work. They give it back, right? We need to think about better uses of those funds because they exist. And to do that, we have to actually support government reframing who a victim is, who they have in mind of who deserves those services are, right, the deserving victim, and they do not see the people we see and don't understand the needs of those that we know need the support and resources. So I think that thinking about rethinking, I would blow up the whole department and rethink its use. If we really truly used it to address trauma and victimization, I think we could do a great deal. I want government to address racism and bias. And I think that is, full stop. There are so many ways in which race and bias plays out in how things happen. There needs to be ways of monitoring that and holding themselves accountable for that work. And finally, this is not a space that I think government's particularly good at, but this is a wish, is to address staff burnout. There are people who have been in government who do incredible work on the front lines, ranging from policing to foster care to just all the services. I think that we get into that trouble around services is because the people themselves who if they had, I think, their own issues addressed, would do better work, would give better. If we could make those systems more efficient and actually support those workers, I think we would have better systems who understood what this work is if we were all on the same page. I think that I've taken a new world, but I think if government was good at those things, I think we'd see different results across those systems and coordinating.
DeVone, what should government do differently? Yeah.
I'm going to be cautious in saying this, but reducing our reliance on law enforcement in this space. And let me couch that in saying that in reducing law enforcement our reliance on law enforcement in this space, I think it also provides an opportunity to reduce the criticism that law enforcement often has to absorb in this space as well. And that doesn't mean reducing our reliance on law enforcement and then cutting or reducing law enforcement activity. I think we are, and we've been saying this for a few generations now, we're in a global world. I just think there are other things that law enforcement should be focusing their attention on, even at a local level, as it relates to threats from outside of this country. So I just think that in this space, reducing our reliance on law enforcement is a critical piece. And with that, I would say that what government could do better in this space is value, and I think it's been said, but value community assets who are necessary to be working in this space. And that doesn't simply and solely mean just bringing them into government. It means taking care of them inside of government, paying them well. And let me give you just an example. And again, I know where I sit right now and so forth, but I got to say it. In the city of Richmond, we pay law enforcement starting wage $150, $160. And with overtime, we have law enforcement that can earn up to $300,000 a year in our city. We pay street outreach workers inside government a ceiling of $45,000 to $50,000. And they're going into these communities without guns, without bulletproof vests, without a whole lot less at their disposal, because they don't need to have all of those things to do the work that they do effectively. And so, again, I think we've got to change our orientation inside government about how to solve these problems more effectively and certainly more efficiently. I don't think coming out of government that we can sustain the current way we approach addressing this issue much longer.
Thank you. So here's where we are. In a few moments, we're going to open it up for questions. But before then, I want to do something a little unconventional. This is, Carol said it this morning, this is a gathering of family, people who've worked together. It's a celebration of 10 years of the National Network and a cause for thinking positively about the future given the journey that we've traveled. So here's what we're going to do. We're going to take just a moment of reflection for all of us. And I'm going to ask the panel to answer the question, but each of us should answer the question in our own lives, in our own minds. Why do we have reasons for hope? David started this morning by saying this is really difficult work. It's hard because we fail, in quotes, so often. Violence is a problem in our society. But today we want to recommit to the work that we do to the family of the National Network. So we're just going to take a moment of silence, and for each of us to ask ourselves, why is there reasons for hope? It can be a name of a person who gives you reasons for hope. It can be something you saw recently. It can be some sort of breakthrough that you've experienced. But reasons for hope. Moment of silence. Everyone's going to participate in this, and I'm going to start with Vaughn and ask him to give us one sentence answer to why he's hopeful today. Okay?
I'm hopeful because we're all here. And this space didn't exist 10 years ago.
Great. Eric, why are you hopeful?
Wasn't expecting this question, but I'm hopeful because I operate in the spirit of my ancestors. And I know that there's a greater power.
Jeff, why are you hopeful?
I'm hopeful because of the democratization of information that we're all witnessing, even though there's a lot of downsides to social media and ubiquity of video. I think the fact that the public has access to that kind of information on a regular basis means we're less dependent on government to interpret it for us.
Thanks. DeVone, why are you hopeful?
I'm extremely hopeful. I'm extremely hopeful because I'm getting an opportunity to see young men at the center of firearm activity make healthier decisions about how they address the conflicts that they're negotiating every single day without a firearm.
Fatimah, why are you hopeful?
So hard. This is important. I'm hopeful because I had a great-grandmother who escaped the South, lived to be 106 years old, and envisioned a world that could interrupt the ways we've been separated, could interrupt and see a vision of people of color having access to life and thriving. And I'm activated by her story and know that I can envision a world where the structures we've set up to harm and traumatize communities are redesigned to liberate us.
So much. That's pretty deep. I just can't go any further. That's pretty powerful, all of you. So the microphones are located here at the front of the theater. I would ask people to come up and just form a respectful line. I would also ask those who want to ask a question of the panel to identify yourself briefly and ask a question. No speeches, please. No long talk about how great your program is. And I'll be respectfully brutal in shutting anyone down who goes too long. Please frame it as a question, and if you can address it to one person, that would be great. If it's for the whole panel, we'll figure out how many people answer it. But there's one person, two people at this mic, and nobody here yet. Okay, go ahead. And you are?
David Shackner, John Jay College. Question for Vaughn and DeVone. About 7 weeks ago, the entire nation turned its eye to California, Southern California, Poway, the terrorist incident there. Please share with us how your model pertains to preventing terrorism.
I can say mine does not.
Okay, and this side of the room, sir, you are?
I'm Wayne Rollins, and I'm from Miami, Florida. I'm the project manager of the Anti-Violence Initiative / Group Violence Intervention.
Oh, you got a fan club here. Someone just...
Just a little bit.
or irrelevant. I don't know which it is.
But Jeremy, you spoke about, in previous discussions, the tyranny of the funnel.
Oh my God, he's read my writing. Okay.
Oh, we don't come here without vetting. So at any rate, you talked about mass incarceration, prosecution, incarceration, and that whole industry. that is fueled by strong lobbying groups, the police unions, the corrections unions, and so forth and so on. Eric, you mentioned how you were able to move money into these mini grants and back into neighborhoods and investing in the people. So you're up against a giant in terms of the criminal justice system. And what you're talking about probably doesn't resonate well with the police union or the others, or maybe it does. But how is it that you were able to have that transformation of funding to go from the system back into the neighborhood and the people that need to be invested into?
So I would say, echo what DeVone said earlier, we have some really fierce advocates in New York City that every day are lobbying on their community's behalf, speaking out wherever possible, however possible, and building networks across the 5 boroughs. So the advocacy world in New York City is very rich. And those advocates, I'm only sitting here because those advocates support me and have lifted me up, and I carry out their vision. So when I'm in these spaces, I'm the advocacy for the advocate. And you know, this is an inside-out game. So at no point am I part of the institution. The advocacy is the one that's driving this entire movement in New York City.
Great. And over to this side, you, sir. Thanks. It's a good question.
Thank you. My name is Michael Green. I'm at Rutgers University, formerly the Juvenile Justice Administrator for the City of New York for over a dozen years in the 70s and 80s. I really appreciate David's caveat when he talked about the small percentage of individuals who were responsible for the most serious violence. And I would frame that as a form, what he talked about was institutional violence, which includes racism, all the disproportionalities that come with that, including the consistent, very substantially high rate of homicide victimization among African Americans than white people, particularly in the 15 to 24 year-old group. So my question is, and in some ways you've answered it, but I'd really like to hear it more directly, and that is, what is the relationship between addressing institutional violence and interpersonal violence?
Is there someone you want to address that question to, or should we see who wants?
I just
okay. We'll see who wants to take it up.
Yes, that's a great question, and I wish I had. I don't know if Jeff Ward is here. His research looks at this. I know David. He was here the last time we had one of these, but his research looks at not only. I appreciate the question. Institutional violence. Over time, right? So he looks at the relationship between lynchings and I believe incarceration rates across the country, right? And so I don't have his data here, but I'm really, I think it's important, and talk about narrative change, that we understand interpersonal violence in the context of institutional violence. And I think it's hard for people, those aren't the right words, right? They're too kind of distant. What does it actually look like? I think that those kind of data, the work he's doing, put that together.
Let me just make a shameless plug for another project I'm involved in called the Square One Project. Square One is a project located at the Columbia Justice Lab. Bruce Weston and I are the sort of co-founders of it. It's a 3-year effort the hashtag is Reimagine Justice. There's an executive session that meets twice a year at Columbia of 24 people who are writing papers under that heading, and there's a roundtable that meets in different cities throughout the country, also twice a year. And the roundtable is public-facing, outward-facing, and is open to everybody who wants to see it. It's live streamed. Check out our website, squareoneproject.org. The next roundtable will be in Detroit. It's on the topic of violence. The first was in Durham on the topic of the legacy of slavery and white supremacy on our thinking about criminal justice. The second was in Oakland, talking about criminalization and excessive, what we call punitive excess. For each of the meetings of the Square One Roundtable, we commission academic papers. Jeff Ward wrote a paper for the meeting in Oakland, and the meeting in Detroit on violence will have really three segments to it. One is sort of violence throughout American history. So this is a part of our American story of when you think about the continent before Europeans came, it's very different, and that's in part because of our genocide of native peoples, but also the wealth of the country has been built through the institution of slavery itself, an institution of violence, and that has continued. So there'll be a paper on the history of violence, but there'll also be a paper on what the gentleman referred to as sort of institutional violence or systemic violence, or ways that the human soul is challenged by the way the state operates, state violence. And the third section will be on group violence and violence at a community level. But it's very important, the reason we're structuring it that way is to link all of those things together to understand the current day reality. So I encourage you to go to the Square One website, encourage you to either watch or come to Detroit if you'd like to. It's open to observers, so that this issue that we're talking about today is put in those larger frameworks. And you, sir, I'm sorry, we're doing this side. You're next, and you are.
My name is Corey Priest. I'm from Delaware. I'm the community engagement specialist for the Attorney General's office in our state. It's important because I'm the first, I want to consider myself the first, especially in the state of Delaware, who our Attorney General can hire, who was formerly incarcerated and prosecuted by our state. And that goes to touch on DeVone and Eric, where you guys can hire folks who are formerly incarcerated, are part of the streets, as part of the street culture of violence. We call that restorative justice. So I really, really appreciate what you guys can offer to our population that we're serving. My question is, how does the Department of Justice, in particular my state of Delaware, and the AG's office get behind trying to reduce gun violence on the front end, as opposed to when folks are going through the criminal justice system in the courts? I think it's my role to be that in our community across our state. But I just want some advice or some insight on how to address gun violence on the front end.
Who wants to take that one?
Yeah, I'll take it. If I could go, I want to take that, but I want to quickly go back to the last question. I want to caution us not to work in this space with the suggestion that unless we address institutional violence, we can't address gun violence in real time in the communities where it's most prevalent. And here's why. Because oftentimes that's easier to focus on, because we've been focusing on that for the last 100, 200 years in this country. From a policy lens and landscape, it makes it easier for us not to go back to really focusing on work that can have a dynamic, dramatic effect. And that is to say, in most of these communities, Davis reflected on it earlier, a small number of individuals in a city. In those communities, it's a small number of individuals. So again, most people in communities most impacted by gun violence are healthy people. If they weren't healthy, we'd be in trouble, right? So it's important to appreciate that. I don't want to pathologize an entire neighborhood or community around this issue. To your question, sir, a couple of things. One, I think we have to go further upstream. what I learned in another quick story, what I learned in Richmond in the pockets where gun violence was most concentrated was that there were always a younger group of young men, young women who weren't involved in gun violence, but were the next generation of fellows to be involved in gun violence. Why? Because not one public system or community-based service of care was even touching them. Why? Because we're afraid to go where gun violence happens as public systems, as community-based organizations, even within arm's reach of a violent theater. And I can tell you that I would find young people, and I'm talking about that under 16 age, 10 to 16 age, in those pockets who hadn't thought about doing gun violence, but were doing other things that they were being influenced by some of those guys who were in gun violence, who had access to public system and community-based systems of care, but those systems were not built for them. And so we've got to build public and community-based systems of care that are attractive, legitimate, and credible to those younger people. What that often means is another opportunity for individuals coming home from incarceration. So not only with gun charges in their backgrounds perhaps, or not, but what happens is we tend to hire folks that we're comfortable working with, even in public system and or community-based systems of care. I would say we need to have a track of hiring and classification, yes, in public systems, but also in community-based systems of care that take on this asset to go into these communities and engage kids and younger people at a high level of functionality and not be afraid to do it in an effective way.
Good question, great answer.
Eric, you got something for me? One second.
No.
Oh, I'm sorry. I thought he was going to chime.
No, we're going to have to, we got a long line over here. You, sir, you're next, sorry.
Hi, so my name is Clyde Drayton, and I'm a student at St. John's University right now, and I'm actually a summer fellow at Mayor's Office of Criminal Justice. So as I get to see the people's champion, Eric, every single day. And my question pretty much for Mr. Travis and Mr. Butts. I feel like as an African-American male growing up, I was born with an imaginary ceiling, and kind of diving into government and politics, I wanted to serve marginalized people. I felt like I was Yao Ming in a megabus, so just very, very limited in everything. And I kind of wanted to ask, how do you ensure that, I guess there's a pipeline or the accessibility of research and high academics for people that want to get into government and politics or in the research end of things, to make sure that the people, doing the researching the data and analyzing all of these findings reflect the community that they're engaging in. And Mr. DeVone touched on it a little bit, but for the academic.
Good question, Jeff.
Yeah. So I'm a little deluded because I work at John Jay College, and the student body here is wonderfully diverse, and it's not hard for my research center to find young people of color to work on these projects. And I think that you're right. If the voice isn't there, and if the skills to be effective with your voice are not there, and I think it takes mentoring and opportunities and access. And again, I'm probably not in a good position to tell you what the challenges are, because there are not that many challenges here on this campus.
So you asked me the question also. So I was, you might know, president of this college for 13 years. And one of the reasons that I love this place is because of it's not simply the diversity, it's the ambition of our students who are here. And I think it's an obligation of every public university, not just John Jay, to establish exactly the pipelines that you talked about. And that requires creating undergraduate research programs. You don't have to wait until you're in graduate school to be a researcher. Research is the search for knowledge in a disciplined and objective sort of way, and that can happen when you walk through the doors here. So we did that here at John Jay, and you went to St. John's, so you could have been here, right? But there are lots of those opportunities if the institution takes your question seriously and thinks of that, particularly public institutions, as a public obligation of public institutions to prepare the next generation of leadership. So thanks for your question. Okay.
Thank you.
Yeah.
How you doing? Thank you guys for the information you shared this morning. I'm Ray Martinez. I'm the director of the Law Enforcement Planning Commission of the U.S. Virgin Islands. And In 2016, 2017, the Virgin Islands has, by the FBI stats, has the highest per capita murder rate under the U.S. flag of 100,000 residents. As we speak, our local governor, I'm here because we're trying to gather information to start our own Office of Gun Violence, as well as to create a strategy as to how we should address our ongoing gun violence. So my question to the panel is, what do you believe the three maybe chief tenets of a strategic plan for us should be?
Vaughn volunteered, so you want to speak on behalf of the panel? I want to make sure we get everybody else over here. So, yeah.
Well, I don't speak on behalf, but here's my advice. One would be, I would make sure to define your problem, and I'm sure that you may have been in conversation with the National Network about that already. We make reasonable assumptions that are usually wrong, and it's part of why many of our efforts don't work. So I would say that one advice, do a problem analysis. I think the second advice is, I agree with Eric and DeVone that there's a question about who are your community authorizers, right? In the neighborhoods affected by violence, who are the people there that are affected by it, have an interest in changing it? They're going to give you the support that you're going to need to move changes in the public systems, and think intentionally about how you bring those people into a working partnership. And I think the third piece of advice is, who is a person, a champion that would be effective at doing that, who you can vest in government at the highest possible level of authority in order to lead that work.
So this always happens, as we're about to close the session, people come to the line and say, I want to get a question in. So step up to the mic. Here's what I'm going to ask you to do, if you would do us this favor in essence. I'm going to ask all five of you to ask your questions. We want your voices and your concerns to be heard. We'll do the best we can here, and we'll ask these folks to see you during lunch or whatever, just if we don't actually answer your question. Could we do that? Just a quick question, 1, 2, 3, 4, then 5, just so we know what's on your mind, and then we'll do the best we can. Go ahead.
Sure. Good morning. My name is Shauna Majors. I'm the Director of Violence Reduction for the City of Indianapolis. I just want to pack you all up and take you to Indianapolis with me. My question is, I'm frustrated. This is the 1-year anniversary today that I accepted this position, and I can't hire the people I need to hire. So I really just wanted to ask, how long did it take you guys to cut through the red tape enough to get the people that you really needed on your team?
There's one question, and you have a question?
Yeah. Hello, good morning. My name is Jorge Martinez from Texas A&M. I want to know how the work are you doing, taking consideration indirect factors, like, for example, the increasing violence in the border areas, like, say, Tijuana, and it does, how do you face that? Thank you.
Okay. And don't go away. Your question?
Hi, thank you all. My name is Matthew Goodrow. I work for the Bronx District Attorney, Darcel Clark. I noticed the prosecutor's offices didn't come up at all, so I'm curious what, if any, role you see for prosecutors. Thank you.
Great.
Hi, my name is Alvin Sims with Detroit. Just a quick question from a physiological standpoint. We know that people have predispositions to alcohol and drugs. We know that. We know women who have breast cancer have markers. And now we're having studies on slavery, the trauma, and even we know that the Jewish people have markers from the trauma they suffered. Are there any research or any interventions that you're doing to address, to help people understand that you either have toxicity or deficiency? It's not something that you're born, something is wrong with you, but how do you support that in a different kind of way?
Hi, Dira Tradvance from the Health Department. Earlier in
here in New York?
Yes, yes. But my question is from a civilian hat, not a government hat, so I'm chucking that away. Earlier on in your conversations, I know, Fatimah, you were particular in mentioning narratives, right? And we've talked about structural racism, structural violence, institutional racism, and the conversation centers on violence prevention, but it's on the community end. And what are we doing to prevent from the community members to try to impact and change the trajectory of violence in the community, from community members? Narratives are important. Gun violence are, obviously we know the structural and institutional reasons that lead to violence within communities, but what efforts are being done, if any, to address gun violence that is legal and permitted through law enforcement? It's always on the community end, and it's like the onus is on community members to change, but no real effort or real, we know cure violence, we know so many different innovative ways, but nothing really talking about gun violence and changing it on the other institutions that we do know that also perpetrate it.
Great, thanks. So, wide range of questions. Anybody from the panel who wants to pick one up that you can answer quickly, I'd be grateful for that, because there's an enormous variety. Every question that's not answered, we'll find each other during the break. Yes, DeVone.
With regard to Indianapolis or Indiana, red tape, government red tape, I'd say get to know your human resources people, get to know your city attorney. Those are going to be your most conservative folks, I think, inside government around hiring practices. Get them as much information and education that you can get to them, and make sure that you provide them with as much example of success that you can possibly provide them with. It's out there.
Great. Any other questions somebody wants to pick up? DeVone?
Two real quick ones. On the prosecutor side, I think it's the same as the reform movement, more around prosecution in general. I think vesting someone in the prosecutor's office to own the issue of reducing gun violence, work in partnership with the police department and other community intervention providers, because as other justice system agencies, the right cases are not often prioritized. Sometimes holding people in jail can save a life, but you have to be in conversation with people who have that information in order to act effectively. So that would be one. The second one, I think, on the markers around gun violence, from my perspective and my knowledge around theory and practice, is really, if you've been shot before and if you're socially connected to somebody who's been shot, those are the best predictors of who's going to be at very highest risk in the near term. So if you follow the shootings and you understand the social networks, that will lead you where you need to focus.
Right.
One quick comment.
Go ahead.
I just want to make this last comment, which is when we're evaluating the Cure Violence Program and crisis management system here, one of the most exciting findings we had was in a neighborhood where we did surveys of 18 to 30-year-old young men across all these neighborhoods. And in one of our studies, we found that neighborhoods with these programs, with these neighborhood-based cure violence programs, actually showed a slight increase among 18 to 30-year-old men in their trust in law enforcement and willingness to call upon them in an emergency. So this is not a police versus community issue.
Right. Anyone else want to pick up any one of the questions that we heard? Seeing none. So last 30 seconds, moment of personal privilege. I used to live here at this college and was part of the creation moment for the National Network 10 years ago with David, and helped bring David here, and there'll be another discussion about that at the reception tonight. But I just want to tell you, all of you, that it's just one of the thrills of my life to see all of you here 10 years later doing the work you're doing, with the results you're getting, and to see this evolution of the work that was represented on this stage. So please join me in thanking everyone on this panel.